if I can come to you, Dr. Pankhania, first of all, what have the JCVI actually said?
The JCVI, with its own deliberations, I must emphasize, which is in a closed meeting, so we do not know what papers they were referring to, what their deliberations were, what their concerns were, eventually said that our brief is on health, and our brief tells us that the benefits are positive. In other words, there are marginal benefits. So I must emphasize, you said too marginal. That gives a negative emphasis to what JCVI said. They actually said they are marginally beneficial. And then when you take the benefits plus the other factors into account, of course, immunizing is one way to protect children, community, and suppress infections in this pandemic.
But children are, correct me if I'm wrong, they are barely at threat in and of themselves. Children, without reference to the wider society, children are at a vanishingly small risk from the infection itself. Or am I wrong?
Let me lance this lousy boil that keeps on being repeated by people like yourselves, Neil. And I must say, I find it difficult to engage with GBNews in the manner in which we are expected to. And my reasoning is as follows. I must say this because you have been given 4 or 5 minutes on a pre-prepared statement to say what you like and to give your personal emphasis on your take on giving or not giving vaccines. And then people like myself have got a few minutes in which to articulate my case and say, I disagree with you. Well, having said that,
you're using up the time in justifying what you're about to say. I think you'd be better off using your time.
I'm about to, but I had to say it, so please let me carry on. So, with respect to giving vaccines, prevention is always better than dealing with a case. Prevention, especially as the great unknown, which is long COVID, we don't know how many percentage will go on. 2, 3, 4% of a large number is quite a large number of children, nevertheless affected by long COVID. Furthermore, the line of is the vaccine harmful? No, it is not. If you compare the vaccine to the disease, the vaccine is not harmful. And I must emphasize this. So when you go on about myocarditis, rare and self-limiting via the vaccine route. Myocarditis, severe and not so self-limiting if you were to get the proper wild virus infection. Therefore, the vaccines on many, many counts are protective, preventative, and a measure to suppress infections in the school setting.
Thank you for that, Dr. Pankhania. If I could move now to Nadav Davidovitch. Thank you for being with us. A lot of us here in Great Britain have heard a lot about what's been happening in Israel. You know, we've been following developments there with a great deal of interest. Just to bring us up to speed, when did Israel begin injecting children with COVID vaccines?
This happened, first of all, thank you for having me.
You're welcome.
I need to say that you raised a very important question that I want to differentiate. I think that this kind of discussion should be held by different scientific groups. In Israel, we have the Advisory Committee on Vaccination, and we also have a specific group advising on COVID. I'm taking part of it. And we presented all the data before starting vaccinating children several months ago. I think it was, if I remember correctly, during May. By the way, I have 3 children, 2 are already 28 and 24. I have one who's 14. He himself wanted to be vaccinated, and we were very happy. I think that in these ages, it's also important to, of course, to have a dialogue with your child. And in general, when you're doing these discussions, and I totally agree with what was presented by my colleague before, we're talking about safety first and then about efficacy. In terms of safety, the signals of myocarditis actually, I'm talking about Pfizer because in Israel, we are almost vaccinating just with Pfizer. It's an interesting story how it happened. We became a model country, and this is interesting by itself. We have some Moderna vaccinations. The scientific officer is a graduate of Ben-Gurion University, where I'm from, so we're very proud of it. But both are quite similar messenger RNA. I must say that in terms of safety, the vaccines for children, especially those who are 12 to 16, even for myocarditis, are quite safe. The myocarditis signal was mainly among those between 16 to 22, and also, as we mentioned before, quite rare and transient. And the risk of a child acquiring natural disease is sometimes 10 to 20 times more, and suffering also from long COVID. It's a big problem. Now, I want to say
I would have to say that is disputed by other eminent medical professionals who have said, I'm not saying it, other medics have said that children would do better to naturally contract the virus, beat it, and would thereby have a considerably greater margin of protection.
I would never do that.
That is being said by other eminent medics.
This is not the mainstream. I'm so sorry. At least according to the Israeli data, and I'm also following UK data and US data, we are in very close contact with Professor Arnold Monto. He's the chair of the FDA COVID vaccines. This is not the data, the mainstream data that I know and I was presented, and I'm dealing with vaccine policy for more than 2 decades. In general, I need to say that many of your arguments were raised also in the past about vaccinating children, about consent, about acquiring, natural disease, etc. I need to say that with COVID, as with other vaccines that are in the national schedule in many countries, vaccine saved so many lives. In Israel, we have a campaign now to go for vulnerable groups, including the Bedouin community in the Negev, because of having better access. So in Israel, we see just the opposite. We want to give more access, and people are very happy to do so. We have a tiny minority of about 3-4% that are very vocal on the different social media. Now, I'm against compulsion. I think it must be a decision by the family, and also we need to involve children, but both in terms of safety and the benefits. And when we're talking about public health, it's not just about physical benefit. In public health, we're taking into consideration physical, mental, and community benefits. Having children less isolated and going to school, these are definitely public health benefits, because going to school is also affecting your health.
Israel is amongst the most vaccinated countries. You've been ahead of the game when it comes to vaccinating. You've also, according to what I'm seeing in the press, you're also one of the COVID cases hotspots on the planet. How can those two things be happening simultaneously? If the vaccines work, why has Israel got amongst the highest rates of infection? Both numbers are going up, numbers of vaccinated, numbers of infected. Why is that?
So things are much more complicated. It's not just about the number of infected. There's no vaccine in the world that is 100%. Unfortunately, because we started quite early, there is waning immunity, and that's something also being discussed in Israel and other places. So after 5 and especially 6 months, we see waning immunity. But if you take now the rate of hospitalization, severe cases, and deaths, Israel is one of the best countries. And by the way, I want to say that anytime in public health also, vaccination cannot be the only solution. We don't like just vertical solution. When you want to have a social determinants of health, and they see also how some communities, like in Israel, Arab community, ultra-Orthodox community, they live in very densely population places. you need to also to have masks. You need to see how you can help a population that are at risk. Now, I want to maybe say just another sentence, if that's okay. I don't think that all countries should have one approach. It's legitimate to have discussions. I want to say that the Association of Schools of Public Health in European region, that I'm on their executive committee. By the way, I'm also an honorary member of the Faculty of Health of Public Health of the UK. So Professor John Middleton is the president of ASFER. Because of the different discussion, we said that first of all, it's important to have a prioritization. And of course, in different countries, you have different access to vaccines. First, you need to vaccinate children that are high risk. This is most important. And again, giving access to vulnerable groups. And we are against enforcement. But we were very positive, the Association of Schools of Public Health in the European region, of vaccinating children, but starting with high-risk children. This is also how Israel started at the beginning.
Thank you for that, Nadav Davidovitch. Dr. Pankhania, if I can come to you lastly then, how do you reassure parents? How do you reassure them in the face of, you know, the what I would say are justified concerns? How do you reassure them?
We must also remember the bigger picture, which is we already immunize for seasonal influenza. We immunize boys against rubella, and boys have a mild, insignificant illness, but we still do that because it is a community thing to do, which is we don't want pregnant ladies to encounter rubella. So we are already doing protective public health actions. How do we reassure our people? That falls upon wider health community, including the government, to inform, and to inform honestly, correctly, sincerely, inform, advise, take them through the issues, and take your patients with them. I, like my colleague from Israel, have never been in favor of coercion. So there is a job to do here to inform, advise, educate, and take our parents and our children with us, but we will never force them.
Surely you would see, it's easy to understand that at the moment, coercion or not, unvaccinated people, unvaccinated children will quickly receive pariah status. It won't be a choice. If people choose not to, and if children aren't vaccinated, then the pressure is already there. You know, that coercion is already there.
But
whether it's mandated by the
right. We also have the right of people that are vaccinated to be protected. I'm against using Green Pass, as it's called in Israel, for coercion. This is a measure to open the economy and to remember that during COVID, using vaccination and other measures, we can prevent, you know, the public health effects of closing and limiting many interactions. I'm against using it, for example, at schools, so children can be tested if they don't want to be vaccinated. We cannot use it for public transportation, but we can use it for sports events, cultural events. And the idea is not to coerce, but to protect those who are vaccinated, and also to see that the economy is open as much as we can. We are living really in a very difficult time, and we need to see how we can live with COVID. But living with COVID is not doing everything. It's about protecting people as much as we can. And I think we're very lucky we have the vaccine, and we need to give it much more around the globe, because the problem that since around the globe we don't have enough people vaccinated, we're going to see more and more variants. Again, I think in each country there should be the discussion. There shouldn't be, and this I agree with you, there shouldn't be pressure from politicians. I think it's a very bad idea, and we need to have the trust of the people. Now, within a scientific discussion, public health is not just about medicine. It's also about mental health. It's about you know, the cognitive development of children and many other factors. And I'm sorry to hear that your discussion are close to the public. I think this should be open to understand exactly what were the discussion. This is very important.
Absolutely.
Dr. Pankhania,
absolutely, I agree.
Can I ask you, Dr. Pankhania, how many rounds of vaccination is it going to take? You know, you're there in Israel, there's been, you know, 2 jabs, now moving on to a booster. There's been talk, whether it's going to happen or be delayed or whatever about a third vaccination round in the UK. How many jabs will people have to get?
So your question is with respect to decreasing immunity, and my answer is as follows. Instead of going along the line of boosters with decreasing immunity, we should be going along the line of immunize as many people as possible, as fast as possible, all over the world, and then take stock. Because if you immunize many people fully, you will find that infections are suppressed. And when you suppress infections, you do away with the need for boosting and then boosting again. And therefore, it is a better strategy to make vaccines available, suppress infections by immunizing across the globe.
Nadav, Davidovitch, can I ask you finally, are you surprised that the vaccination programme in Israel, which was so quick, you've reached such you've penetrated so far into the society with the number of people that have received the vaccination, they've had their jabs, and the infections are still going up, and you're falling back on a third round of immunisation. Are you surprised by the waning of the efficacy of these vaccines so quickly?
First of all, I think you mentioned it also. We need to be very humble in front of this virus. We need all the time to have, serological testing and different kind of both the clinical and epidemiological studies. We are now in what is called the post-marketing surveillance phase 4, and we're doing it in Israel because we have a very well-organized public healthcare system. That's something that we are very lucky, including in the UK. Countries that without public healthcare system, like in the US or other places, are doing much worse. So we are following all of the data. I'm not so surprised, by the way, with hepatitis B and the other vaccines. There's a very similar schedule of, first dose after 3 weeks or 4 weeks, and then after 5 months or 6 months. And we thought that we had got into herd immunity. I thought it was a mistake, because when you're not vaccinating also children, it's very hard to get, almost impossible to get there. So we are protecting, we are very protected for those who are above 15. We saw the waning immunity. This is why we're giving the third dose. But again, vaccination won't be enough. First of all, if we don't have vaccination around the globe, and here we need to work also in our region about vaccinating also Palestinians. I think it's very important. It's our responsibility, and also other countries. There is the COVAX initiative, but unfortunately it's not enough. But we need to take into consideration with COVID also non-physical aspect, the long COVID. We need to strengthen the public healthcare system and learn to live with it. And I need to tell you something that it's by historians of medicine. I can assure that epidemiologists are not going to decide finally when the epidemic is over, in a way. Of course, we're going to give the data, but it will be some kind of a social decision. And again, it's not from a deterministic kind of, thinking, okay, people will die. No, we need to strengthen our public healthcare system, because it's a part of our national security, maybe even more important, but not just about COVID, about many other things. And I think that COVID sometimes it's taking too much attention from other things that need to be taken care as well.
Absolutely, both. It's been taking too much of everyone's attention for far too long, as far as I'm concerned. And learning to live with COVID, I think, is definitely their watchwords for me.
Welcome to the GB News YouTube channel. You can watch us live 24 hours a day, catch up on your favourite shows, and join in the conversation in the comments below.
Don't forget to subscribe, and you'll never miss any of our exclusive content.